Yeah, I sent out an email yesterday that I was turning on homework grades, so you could see how your homework is affecting your grades. We're asked to do that at the end of week 6, after the second exam has posted. So we are asked to do that so students can have an idea of how their homework is affecting their overall grade. So as you can see, if all your homework's in and you're doing okay keeping up, your cumulative grade goes up, right? And then if you are not turning your homework or missing some assignments, then you'll see that your grade will be lower. And the whole purpose of letting students see that is you do need, and we went over this in week 1, is that your grade at the end of the term is calculated on your 3 exams and your HESI, right? We all know that, right? 20, 40, 60, 80. 3 exams in the HESI. Hang on, I'm just taking attendance as students are coming in. And so if you don't, you guys already know this, being in term 7, if you're not at a 78 after your 4 KGAs, then that homework does not get added in. Okay. However, if let's say you're at a 78, 79, 80, and you haven't turned in homework, then there's a chance that you could possibly fail the class because your homework will bring you down. Does everybody understand that? I mean, that's the way it's been, right? So we're asked to turn the homework grades on so you guys have an idea. Okay.
I have a quick question. Why, I guess it's like more of like a global online nursing classes. Why do online nursing classes do that with homework in week 6? Because like on-campus classes don't do that. So I was just curious because, you can't really, like if you're deciding to drop or not, it really isn't dependent on like homework. Does that make sense? I just didn't know if there was a different goal that online campuses had versus on-site campuses.
Well, I can tell you that ever since this is my 8th term, I think, we've always turned on homework grades so that students can see how their homework is affecting.
Oh, okay.
That's I don't know if you heard the first part of that conversation. So it's turned on so students, and it's turned off. I'll have it turned off by the end of this week. It was to give.
I know. I was just curious if it had anything to do with anything other than like homework impacts your grade or not.
No, nothing.
Oh,
that's it. That's it. That's a great question. Thank you. It's just to let students see how their homework is impacting their grade. And kind of a push to, if you haven't turned in homework, to get things turned in, right? So, and I'll be turning those off at the end of the week. Did anybody have a question? Anybody have any questions about before I forget, if you could all put your name in the chat, just so I can take attendance that way, that'd be great. And then we'll do the attestation at the end. Did anybody have any questions about my announcement with regards to mid-module assessments? Did everybody have a chance to read that in the announcements? Yeah, no. Okay, Tiffany's shaking her head. Okay. Yep, so I'm going to be working on those in the next couple of days. And I'll be sending them to you, and then you can review them, and we can set up a time to talk if you'd like to. If you want to do your mid-module assessment and your exam 2 review together, we can do that. Whatever helps you guys out. I know your time is very limited. So, but I really would like to go over the exam with anybody who scored less than a 78, or anybody actually, but primarily below a 78, or 78 and below. So, okay. So, anybody have any questions before we get started? No. Can you guys help me? Do you guys know what we're covering tonight? You know what chapters and topics and everything? Have you had a chance to take a look at the PowerPoints? Yes, no, what? I'm just curious, so I know how much detail I need to go in. Has anybody had a chance to review the PowerPoints for tonight?
I've looked over them. I started reading earlier, but like I said, with the PEDS exam, I needed to focus on that as well. So
Sure. Sure. Thank you for your response. I appreciate it.
5, 11, 12, and 27 in the new
Yep.
edition.
Yep. So chapter 5 is economics in healthcare. Chapter 11 is infectious disease prevention and control. Chapter 12 is communicable infectious diseases, specifically talking about a few very common infectious diseases. And then chapter 27 is violence and human abuse. Okay, so I would like to go through each of the PowerPoints for each chapter pretty quickly because I want to get to the case study. I really want to do some case studies tonight. And there is a case study associated with 3 of the 4 chapters tonight. Okay, so let me start with that. Okay, so this is, whoops, oh, take that back. I need to share my screen. So let me share my screen. Oh, does anybody have any questions about the group project that the initial project is due Wednesday? Everybody working on those, I hope?
I do have a question.
Sure.
When I go in to try to get like the peer review document, it says I don't have authorization.
Anybody else having that? Is that happening to anybody else?
Yeah, I'm having the same issue.
Okay.
Yeah, mine's the same way.
Okay. All right. I will check that. I will pass that on to our course lead, Dr. Lundy, and we'll see has anybody been able to complete a peer review? Okay. Thank you, Shauna, for bringing that up. I appreciate it. I'll follow up on that. Okay.
Thank you.
You're welcome. And then again, if everybody could put their name in the chat, that'd be fabulous. Okay, so let's go to PowerPoints here. So, economics and the delivery of healthcare in the US. Okay, so here's our objectives for the chapter. Okay, you can read through these, but this is what we need to be focusing on in the chapter. I have highlighted a few parts of the book that are also going to be important to help you understand the concepts of how economics influences healthcare. What do you guys think? How do you think economics affects our healthcare? What kinds of things do you think play a part in it? What do you think?
Inflation.
Pardon me?
Inflation.
Definitely inflation, yes. What else?
what type of treatment they're going to receive in general.
What about health disparities? What's a health disparity? Health disparities are with certain populations and lack of access.
Where they live, how much they make, their education.
Exactly.
I thought I was unmuted when I said it all, but I apparently wasn't.
Oh, yeah, that's exactly right. Tiffany's exactly right. Those are what health disparities are, and they certainly affect the economics of our healthcare system. One primary example is maybe the uninsured. Where does the uninsured go for care? You're muted, Tiffany.
Hospital, ER.
Yeah, the ERs, right? So here's the introduction. So this is healthcare disparities and how they play, what's their effect on the economics of our healthcare system. All right, we do know that there's a link between poverty and poor health outcomes. That's obvious. And did you guys know that the United States spends more on healthcare than any other nation? Okay. And our last bullet point here, knowledge about healthcare economics is particularly important to community-oriented nurses. Why is that? Remember, community-oriented is you're looking at the whole population, right? You're trying to look at the risks and the needs of the entire community population. Where community-based nursing, remember, you're working in the community with the ill. So why would healthcare economics be particularly important to the community-oriented nurse?
Or it helps with the distribution and consumption, consumption, and production of like goods and services.
Okay.
Like resources, limited resources.
Bingo. Resources. That Stephen, that's part of it. Erica just finished the other part of it. Resources. A lot of times community-oriented nurses and public health nurses are responsible for the distribution of resources, right? Very limited resources in public health. So community public health nurses are having to make those decisions about maybe what programs to start, what clinics to start based on the needs of their population. Maybe it's a population that has lower immunization rates. So maybe they want to spend their resources on immunization clinics. Okay, maybe their population has a high suicide rate. Okay, whether it's amongst children, adults, just suicide rate in general. Maybe they want to spend their resources on suicide prevention. Okay. Okay, so what are some of factors that are affecting resource allocation? Certainly the uninsured. And I want to just stop and mention real quick, because I want to show you guys what we're doing here. Okay, oops. Okay, so we're at factors that affect the allocation of resources. I just want to go in the book and show you what I'm doing. Okay, so here's your chapter 5 in the book. Okay, your PowerPoint is a summary of the chapter. Okay, so what I've done, we've already gone through the objectives. I'm just showing you how these dots connect in case you want to research more about these. Okay, so I'm highlighting what we're covering in the PowerPoint. So here's your healthcare disparities, but I want to go down a little further since we're at factors affecting resource allocation in healthcare. Okay, that's what slide we're on in the PowerPoint. Okay, it talks about the uninsured. Okay, so here we are. Okay, so do you understand? We need to follow along in the book that way. So as we go through the PowerPoint, if you need additional resources or additional reading, this follows along exactly how the chapter in the book. So there's no need to go over both, I guess is what I'm saying. This is a snapshot. Does that make sense to everybody? Okay, so factors affecting resource allocation. Definitely the uninsured. Why? Tiffany, you already said it. If you're uninsured, you show up at urgent cares and ERs, and it's a whole lot more expensive to do care that way. Okay, what if you live in poverty, whether you're individual or a family? How does that affect the allocation?
Well, there's like an increase of risk, like risky behavior.
Yep. And you're probably less likely to seek healthcare, right? Until it reaches a crisis point. Right? And then access. Medicaid, people in the community on Medicaid, safety net, Affordable Health Care Act. So these are all resources to increase your access. Okay. And then the last bullet is rationing. Okay. Who gets what? And this is a good slide talking about primary prevention. Primary prevention is really important in the health economics of, or the economics of healthcare. Why? Because we already know that the costs of healthcare, we have the highest costs in the world, the United States. So if we can start to, not start, but continue to try and focus most of our energy in primary prevention, right? The economics become more manageable, right? So we know that behavior and lifestyle has been shown to have the greatest effect on longevity. So give me some examples of primary prevention when it comes to behavior and lifestyle. What could you be doing for some primary interventions?
Exercise and
Education,
Mm-hmm.
depending on what it is that you're trying to educate on, will kind of sway you on which way you go.
Mm-hmm. I mean, what if you're a community nurse in a community that has a high obesity population, or you have a high diabetic population, or you have a high elderly population? You can gear your primary interventions around those particular communities. Maybe with the elderly, you're educating on risk to fall. Maybe with diabetics, you're educating on caring for yourself as a diabetic. Obesity, maybe you're educating on healthy lifestyle,
Proper exercise for them.
proper exercise. Okay, so we know that high values should be placed on primary prevention. I mean, that's a given, right? If you can focus on primary, you're less likely to get to secondary and tertiary. Okay? And that's exactly what I just said. Despite the significant impact of behavior and environment and the health, that most healthcare dollars are spent on secondary and tertiary. It's not that we don't focus on primary, we do, but we don't do it enough, and therefore people become at risk for certain things, and then when that's not dealt with, it becomes an actual condition or disease. Okay. Healthy People 2030 goals are examples of strategies to provide better access. What are those, and as well as levels of prevention? So let's go and talk about those. So levels of prevention, I'm on page 83 in chapter 5. Okay, these are levels of prevention with regards to the chapter we're covering. So let's read through these, and if you don't understand why they're primary, secondary, tertiary, let me know. Right, so a primary strategy would be to work with legislators or insurance companies to support the ACA. Okay, try and teach about health promotion and how to reduce the risk of disease. Does everybody understand why that's primary? Okay, secondary, encourage pregnant who are pregnant to participate in prenatal care and the WIC program, right? Because we want to increase the number of healthy babies and reduce the cost of preterm or problems during pregnancy. So everybody understands secondary, we're identifying a risk population. Okay. And then tertiary, participate in home visits to moms who are at risk for maybe abuse or neglect. right? We want to try and reduce the costs related to abuse and neglect by providing guidance and education on newborn care, postpartum care. Does that make sense? Do you guys understand that? So that's your levels of prevention. And then let's go to the Healthy People 2030 box. So if you're asked a question on Healthy People 2030 that has to do with access to health services, these are the 4 correct answers. Okay, there may be lots of other things, objectives that we might want to see on that list, but for right now, this is what Healthy People 2030, this is their goals. Okay, and you can read those, but we need to understand and be familiar with what the objectives are related to access to healthcare services. Okay. Nope. Okay, so we'll review both of those on slide 7. So slide 7 is probably a slide you want to star to make sure you go back to the book and pull up that specific information. Okay. We don't need to know about the history. Challenges for the 21st century. One of the concerns we have is the reemergence of old communicable and infectious diseases. We're seeing larger foodborne disease outbreaks, terrorism, chronic disease is certainly prevalent. Health disparities are definitely apparent. Technology is always improving. Labor force changes. The estimated retirement just for nurses alone, the estimated number of nurses retiring in the next 5 years is astronomical. Okay. And then changes in nursing education, and certainly the Affordable Care Act has given a lot more people access to health care. Okay. Okay, so what are some factors influencing costs in healthcare? Well, certainly the demographics are changing. It's right here about the aging population. Okay, most of our healthcare dollars go to chronic disease management.
So I have a question on this.
Sure.
With
Excuse
baby
me.
boomers being on their way out, and I don't mean that offensively, I mean it in just in general, like the older population that are really sick, and as things are going, how will that affect it? Since I don't know how I want to phrase it. Since a lot of dollars go to that aging population, and I know everything continuously ages, but as that aging population those baby boomers become towards the end of it, does it kind of backpedal and things decrease in cost?
Well, but then you have the next generation coming up that's living longer as well.
Right, but they're also aren't we seeing in this generation more, not as many chronic illnesses? I mean, yes, we're seeing an increase in obesity, and we're seeing increases in certain diseases. Like, I know at one point in time they were saying that, for instance, autism, that they were using it as, just a generalized thing. So like handing it out to just everybody, but there weren't those like chronic illnesses. So is it still going to be going to still continuously get higher and higher in cost?
Well, I think as healthcare costs increase, let's just say my age group. Okay. Let's say my parents are still alive. So they're in that age group in the 80s where chronic disease is rampant.
Right.
Okay. Chronic disease for me may not be as rampant, but the healthcare costs keep going up and up and up. So if my generation's chronic disease is not as prevalent as the current group of the 80s, the costs are still going up. Does that make sense?
Yeah, so that's where I was saying, like, if that cost is going up in your age group now, it's not as prevalent as in your parents' age group. Is at any point in time, do we see that trend in costs come back down because it's not being
Well,
not
that
being
that
addressed as
remains to be
much?
seen. That
Okay.
remains to be seen. Certainly, if we can, in my opinion, and from what I've learned from teaching this class, is the more primary prevention we can do, hopefully that gap
Lessons.
lessens,
Okay.
right? The more we can educate people to take care of themselves, right? Because remember that generation of my parents up in the 80s, and even to some extent my generation, there wasn't a whole lot of primary teaching and primary, take care of yourself. You just,
Right.
everybody, you know what I'm saying? Where it's much more prevalent now, at least I can see with my kids, they are much more in tune to taking care of themselves.
Okay.
And I see that with that generation. Does that help?
Yes.
Yeah, thanks. That's a great question. So for right now, the demographics that are affecting healthcare, the aging population, people are living longer. Okay, technologies. I mean, think about it. Gosh, when I started nursing, I'm going to be a nurse next May for 40 years. 40 years. I can tell you there was hardly any technology when I started. It's amazing what we've come to. And then
Congratulations.
Pardon me?
Congratulations.
Not quite yet, but I'm almost there. 40 years.
That's awesome.
Thanks. Chronic illness is a big. I mean, we primarily talk about them in the rural population. That chronic disease is extreme, very, very one of the most is the most common problem in the rural. But chronic disease in general is where most of our healthcare dollars go. Okay, and then financing. Okay, this is where Medicare, Medicaid. Okay, so tell me the difference between Medicare and Medicaid, because you are going to get asked this on exam 3. So we might as well just know this off the bat. What's the
Medicare,
difference?
you have to be a certain age.
What age?
55.
5.
And slash or. What's the other qualification for Medicare?
Be skilled care.
Yes.
nursing
Okay,
care.
hold that thought. Yes, you're right. Hold that thought. But what's the other qualification? You have to either be over 65.
Disabled.
Oh, disabled.
Disabled at any age. And then what's the most important service that Erica, answer this for me. What service has to be provided to be eligible for Medicare reimbursement?
A skilled nursing.
Skilled nursing. Okay, Erica, what's skilled nursing? Is it?
It's like RN activities. It's like the difference between an RN and like a tech.
It's not, okay, it's
Like
not
we're not
personal
doing,
care
we're not
services.
doing ADLs. And we
Exactly.
may be doing ADLs,
Yes.
but we're also teaching like wound
Exactly.
care or like
Exactly.
medication administration, stuff like that.
Yep. And so, thank you. Medicaid. So what's Medicaid?
That's for like the people in poverty or like under a certain income level.
Yep. Income driven. So the way I tell the difference for you, the two of them, since I was in school nursing forever, I used to get Medicaid is what we tried to get our families on. Okay, if they didn't have insurance. So because I used to always get confused about the two of them. I would call the Medicaid office and I'd say Medicare and they'd say, Kathy, it's Medicaid. Okay, so the way I remember it is Medicaid for me was Medicaid. So I was trying to aid the families in getting insurance. So that was the goofy way I remembered it. But so it is income based and it doesn't need to be skilled nursing care. Okay, that can be for the ADLs. Okay, but that's the big difference is how do you qualify? Okay, know that Medicare is that's the other difference. Medicare is a federal program. where Medicaid is administered by the states. So those are the major differences. Okay, and then some other public support, TRICARE. We all know what TRICARE is, right? Do we all know what TRICARE is? Somebody tell us what TRICARE is.
That's for like veterans or
Military.
people in active service or
And their
retired from
families.
the military and their families.
Yep. And then we have VA, we have Indian Health Services, we have the Affordable Care Act. And then private support is all the insurance companies. Sorry, I'm still got my COVID cough. I don't need to know that. Economics in the future of nursing practice, right? You as upcoming nurses need to plan for future changes in healthcare, right? We want to continue to focus on improving the overall health of the nation, right? We can have an effect on changes in the healthcare system. We can. And after reading your professional development plans in week 1, I would assume that a lot of you are going to be excellent nursing leaders in the future that will look at the economics of healthcare and be part of that change. Okay. So any questions about economics? You feel like you have a broader understanding of things that are affecting, issues that are affecting health, primary care. That's where we got to put our efforts. Okay. Let's go to the next chapter. Next chapter is infectious disease and prevention and control. This is a massive topic in public and community health. Why do we think that is? Because you're out in the community, right? Where infectious diseases.
Is this dealing with because of some of the homeless population is increasing?
Oh, there's many factors of it. That's one. What are some other factors that increase the risks of infectious disease in the community or transmission?
Lack of education.
Okay.
Immunization status.
Yep. That's a big
Basic
one.
lack of healthcare.
Pardon me?
Basic lack of healthcare.
Absolutely. Okay, so have a look at your objectives. Okay, worldwide concern about infectious diseases. One of the biggest risks is people moving around, people traveling around, people moving from one place to another, bring their diseases, bring compromised levels of immunity. Some bring resistance to diseases. Okay, I've
Some bring
tracked
monkeypox.
What?
I couldn't resist. I'm sorry. I said some bring monkeypox.
Yeah. Some bring COVID, some bring monkeypox, some bring HIV, some bring hepatitis. Right? I mean, I'm convinced that Tom and I, a week, 2 weeks ago, Thursday, when we traveled back up here to Wisconsin, we both got COVID. I'm convinced we got it during our day of travel. We simply went from Denver to Minneapolis, hour-and-a-half flight. But somewhere in the airports or planes, we both got COVID. So,
I have a quick question about this. So we're talking about like the traveling back and forth, and it's pretty much like an introduction of your immune system to those pathogens, the bacteria.
Mm-hmm.
And this is almost identical to what all the kids went through beginning of last school year after being like isolated and locked down and all of that. And then you saw like a rise in like hand, foot, and mouth and like all of these different disease illnesses that usually you don't see.
So why do you think that happened?
Well, because they were isolated from everybody.
Correct.
That's happening again this year. My son has it right now, hand, foot, and mouth that he got at school. And they said that it's like running rampant again.
So when you're,
I don't get that. If they've been isolated, if everybody's isolated and in their own individual spaces, and then they come back out, and that wasn't as prevalent, it wasn't as much out there, diagnosed out there, why is it all of a sudden?
It's not really
So-
all of a sudden, it's that it's the exposure is there. It's like our immune systems weren't built, and then all of a sudden, you know, you go to a different country or you travel and your immune system's like almost in shock. Right?
Erica,
that correct?
yes, that's excellent. Erica's spot on. You isolate, you don't expose your immune system to anything, right? It just goes kind of dormant, right? Because
It's
you're
like that. What is that?
you're not
Autonomic
exposing
nervous
yourself to, I mean, on any given day, you're touching, feeling, you're touching everything, bacteria, whatever. The whole for your immune system can fight that off. But your immune system becomes dormant when you've isolated for so long. Right? And I had isolated for quite a while back home in Colorado. And boom, I go out in the community and I was close enough to somebody or whatever. And my immune system's at risk because of my cancer a few years ago, my radiation. So I'm already immunocompromised. So I put myself in that situation to travel and boom. Does that make sense? Tiffany, what are you thinking?
I don't like that rationale.
Okay.
How do you not like
You know,
that
I
rationale?
feel like
No.
it's more like because we cleaned everything and our immune system got so used to everything being cleaned as opposed to, because
But
if you-
remember,
Because the
remember
only people that you're touching are like your people. Like it's a smaller scale than like traveling across nations, but like traveling across the community, like your family has its own set of germs. Like that is your body's natural, what is it? And adaptive, not adaptive, innate immune. And then your immune system isn't able to have adaptive immunity because it's not adapting to anything. So have those antibodies, and like you don't have that response. And then you go to meet a new family, go back to school, travel across nations, you're
exposing
different-
yourself to other. Erica's exactly right.
Mm.
You want to respond, Tiffany?
She will in a text, I'm sure.
Oh, okay.
I mean, I get what she's saying, but I also think like, and I can only relate it to what I have in front of me. So my daughter, she's immune compromised. She's the only one until the very end, and I'm talking like more recently, as in Christmas, that didn't get COVID within my family, but she was immune compromised. I never changed anything. She never wore a mask because she's autistic. She was out there as much as I was because I had to go out and get certain things. So, I mean, she was still.
But immune compromise can be like a blanketed statement. It's like you're at higher risk. But like think of all the stuff Peyton puts in her mouth and like touches.
Right,
like,
and that's what I'm saying.
You're not
Like,
walking around doing
and
that.
that's
your
how I was-
body's less resistant.
Trying to say it like we killed off all the germs like here at home, and for certain things, I mean she still touched everything regardless. So I don't know if that's because her immune system was built up so high, and like that's just things that had always put in her mouth. That's why I was saying like I just felt it was.
She was exposing herself, even though she was isolated at home. When you took her out, she was being exposed to all these other things, and she held up well.
Right. That's why I was trying to say I was trying to understand it how she was saying it, but I feel like there's also other factors, but I completely agree. I
Sure.
hear what you are saying.
Sure, there are definitely other factors. I think the point that I was trying to make was what Erica stated was when you lived in isolation for a couple of years or 18 months in this COVID, your immune systems went dormant basically. And so you weren't exposing yourself to what you normally were pre-COVID, which is, like I said, door handles, touching everything. in your
I was
given
just making it
day.
smaller scale. Like it's easier for me to relate to content if I can put my hands around it. Like, and that's a smaller scale of what she's saying, right? Like in the community.
Yeah. Okay. Good discussion. Thanks, girls. That was great. We don't need to know about historical perspectives. Okay, we do need to know about this. This is on exam 3. Okay, the epidemiological triangle. Go ahead. Tiffany?
Yes, I'm following and I'm listening. Is this not stuff that we just tested on for exam 2?
Yes, and it's going to be on exam 3.
Okay, I just want to make sure I wasn't crazy and that it's just going to be again that we're tested on it. Okay.
Yep. So we're just going to review it. Yep. So tell me how the agent, the host, and the environment interact. What do you guys, what's the significance of the interactions?
The agent interacts with the host. So the agent
And-
infects the host.
Correct. You
And
have to
then-
have an agent to, you have to have an agent to infect the host, correct? And then what factors might the host have that will determine how sick they get or not, or whether their illness is mild, moderate, severe? What kinds of things affect the host?
If they have a poor immune system,
Mm-hmm.
like if they're immunized,
Mm-hmm. If they have unhealthy lifestyle factors.
Other
they-
like illnesses that can cause, like, say, diabetes. You know, if you have diabetes,
Yep, yep.
you might be at risk for something else.
Mm-hmm. And then
Also,
what? Go ahead.
and also if a group, if more people are immunized, the herd immunity, that makes it, everybody's not easily infected, just like what's happening with the COVID.
Yep. So I'll give an example from the schools. So let's say we had an outbreak or we got a call from the health department that a student was diagnosed with pertussis. Well, for the most part, all the kids should be safe, right? We always do our protective measures and stuff, but we really do need to get in contact with those parents whose kids are not immunized against pertussis for whatever reason. Medical exemption, personal exemption, whatever. Right, Juliana? Because those kids become more at risk now.
Right,
Does that make sense?
yes.
So that would be a host issue, that the child hasn't been immunized. Now, how does the environment play into it? Give me some examples how an environment may be helpful or hurtful. What do we see in COVID? What kind of environments in particular were just super spreaders?
On
Places,
Nursing homes.
yeah,
Ner-
nursing homes, prisons
ner-
were definitely super spreaders because they were confined to a certain area and
Yeah.
couldn't leave.
Right? So what I want you to understand is that all 3 factors are in play when we talk about the triangle. All right, you need to have an agent, you need to have a host, and obviously there will be an environment, and what factors in that environment will affect how that host reacts to the agent. Right? So for example, COVID infects COVID, the agent, infects elderly population in a nursing home. Does that just spell trouble?
yes.
Okay. Give me another example. COVID is found to be in a high school class, that's the environment, with a bunch of healthy kids. Does that present as big of a problem as the nursing home? No. So it's all determined on what the agent is, how healthy are the hosts, and what's the environment. That's all I want you to know about the epidemiological triangle. Okay? Transmission. Here's where I want you to read about that, because this slide is too big to cover. It's just giving headers. So I want you to look at, oh, well, we'll come back to that. If you want to read more about your agent, host, and environment in the book that we just covered in the slide, it's on page 197. Okay. Okay. Here's the section I want you to read. Modes of transmission on page 198. Okay, that goes along with right here. We're on slide 6. Okay. So please know what each of those modes of transmission are right here. Vertical, horizontal, common, and vector. What's a vector transmission? What's a vector?
Mosquitoes, swine flu,
Ticks.
ticks.
Okay. Okay, the next okay, next slide talks about what's the difference between an incubation period and a communicable period. Okay. Right here. All right. So I want you to go back and review those two. In this chapter, there's a lot of definitions. Okay, and then what's the difference between, this is the spectrum, so what's the difference between an endemic, an epidemic, and a pandemic? You guys know the difference? What's the difference?
Pandemic is worldwide.
Mm-hmm.
Epidemic, isn't it region?
Mm-hmm. In a region, yep.
An endemic, isn't it like just like a community or like one city or town?
Endemic
area.
is it's so let's take COVID, for example. We're now moving towards an endemic. It's kind of like the flu. Let's take the flu, for example. The flu used to be a pandemic, but now it's endemic, which there's always going to be a constant presence of that disease. Make sense? And then I just want to mention list of reportable diseases. I'm sure it's on our PowerPoint. I just want to mention it. Reportable diseases. So there's a federal list of reportable diseases. There's a state list, there's a county list. So as a school nurse, we had a whole booklet of infectious diseases that are reportable to the health department. Okay, so if you're going to be going into community nursing, you will need to know this. Okay, so certain communicable diseases are reportable to the local health department. Okay, so I just bring that up because that is one of your roles as a community nurse. Okay, this is important to know here. What are the 3, I think this is one of our attestation questions. What are 3 emerging infectious diseases? Okay, Ebola, West Nile, and COVID. Okay. And when they say evolving, emerging, they talk about over the last 10 years. Okay. How do we try and prevent and control communicable diseases? Primary, right? We seek to reduce the incidences by preventing it before it happens. Secondary, we aim to prevent the spread of it once it occurs. And then tertiary, we work to reduce complications of people that have been diagnosed with a communicable disease. Agents of bioterrorism. We don't need to know that. I mean, we do, but what are some vaccine preventable diseases? Okay, these are the immunizations, right? What do we do? What do you guys do if you're in the schools and you are working with a family? Let's say you do your immunization, reports, and you see that 9% of your families, the kids are not vaccinated. Parents have filled out personal exemptions, medical exemptions, religious exemptions. What do? How do you communicate with those parents, and what's the most important thing to tell them? Well, number one, you can't be judgmental. They have every right to make their own decision, correct? And we can try and use it as a teaching moment, that by letting them know that vaccines are the best, is the best choice against getting these childhood immunizations. Vaccines are the best for preventing these diseases. And then they're free to make their choice, obviously. But we try and use education first. Okay, and then we have food, water-borne diseases, okay, vector-borne, disease of travelers, we talked about that, people bringing things inside and out. We have our parasitic diseases. And then there are, what are some healthcare acquired infections? Anybody work in a hospital that's had an outbreak of, say, MRSA?
C. diff.
C. diff. Those are the two big ones. Okay. Want to go back here. We've covered most of this, but I want to go back up here and cover the Healthy People 2030. So make sure it's highlighted. Make sure you know this for this particular chapter. So these are objectives related to infectious disease, foodborne illness. There's 3 objectives. Please review those. We already reviewed, I believe we already reviewed nope, we didn't. That was in the last chapter. Okay, so levels of prevention. That's the other thing we're going to review in each chapter. Okay, at page 202. Okay, what are some examples of levels of prevention for infectious disease? Again, primary, the goal to prevent the disease, prevent the occurrence of the disease. So if we're talking about food here, educate about safe food handling practices in the home. Do you guys assume, I do you assume that if you go out to dinner or you go to a fast food, do you just assume that your food prep person is doing everything they should be? Preparing. What? What?
I said fingers crossed.
Yeah, but I take it for granted that, employees are washing their hands, they're prepping the food the right way, they're cleaning the food the right way. Unfortunately, when my now 28-year-old son was about 6, he got salmonella from eating uncooked chicken at a restaurant. It was a nightmare. Okay, so if we educate about safe food handling practices in the home, hopefully your goal is to prevent any outbreak. Okay, secondary, it's to prevent the spread. So immediately evaluate the possible source of any, excuse me, food foodborne outbreak, right? So monitoring the reporting. Okay. Who's at risk? Who do we need to monitor? And then of course, tertiary, they've already been infected. So you'd be treating any foodborne infection. Okay. I want to direct you to our QSIN box. And I should have done that in chapter 5. Go back, because it's highlighted, go back in chapter 5 and review this box. Okay, these are, I've told you guys each week, the 3 boxes that you need to review in each chapter are your levels of prevention, your Healthy People 2030 goals, and your QSIN box. QSIN is your quality and safety education. These are competencies. They're going to be different in every chapter, or each, there's six competencies. One of them is going to be addressed in each chapter. So here, the competency is safety. Okay. And your competency is made up, they call them KSAs, knowledge, skills, attitudes. So the expectation is that for you to be competent in safety with regards to infectious diseases, this is how you practice. Make sense? Okay. I know we're skipping a lot of this, but I just need you to know the kinds of outbreaks. You don't need to read this chapter from front to back. I just need you to know that, for example, what are some types of infectious diseases? Foodborne, waterborne, vector-borne. Okay? Parasitic diseases. Okay? So just the types of potential, the categories. You don't need to know what every vector-borne, every parasitic disease, just the categories. Make sense? And then your practice application. I always tell you guys, this is a great exercise to go through in each of the chapters. Okay, your answers are found in your Evolve website. And then I would always go through, I will always encourage you to go to the Remember This section. This is an excellent summary of what this chapter has covered. Okay? Questions about infectious disease, prevention and control? Continuing on with infectious disease. Chapter 12 is about communicable and infectious disease risks. Okay, so you're going to read your objectives. That's what we're going to focus on. This chapter is going to focus on HIV, STDs, hepatitis, and TB. Okay. What behaviors put people at risk? What populations are at greatest risk for these? What nursing actions do we take to treat and care for clientele that have any of these 4? Okay. With these particular 4, we know that they are typically acquired by behaviors that can be avoided or changed. Okay. Maybe avoided by vaccines, early detection, primary prevention with teaching, maybe teaching about abstinence or safer sex with regards to STDs. And then we know that the people who live with these chronic infections can transmit them to others. Okay, I'm not going to go through all these slides on HIV. I want you to read through them. But what you can read through them to get a sense of what's the history of HIV, how is it treated. What I want you to know is how it's transmitted. So that's what I want you to know. Slide 5. Okay. Okay, so how is it transmitted? Several ways. Exposure to blood, semen, vaginal secretions, and breast milk. Okay. HIV is not transmitted through casual contact such as touching or hugging. Okay. It's not transmitted by insects, coughing, sneezing, office equipment, sitting next to somebody. Okay. You will get asked about transmission. So know that. Okay. How do we surveil for HIV? Right? We know that it's most often transmitted through sexual behaviors and or needle or syringe use. We know that it disproportionately affects minorities, male to male sexual contact, and transgender women. Did you guys know that? Okay, 38 million people live with HIV. How do we test for it? So I want you to know about transmission. I want you to know who it disproportionately affects. And how do we test for it? Okay. And how do we test for it is on slide 7. Okay. How do we care for people, clients with AIDS in the community? Okay, we should be aware of what resources. We should be able to say we're the school nurse. We should be able to articulate to the staff. We're educating them on how you deal with infected workers, reduce the risk of breaching confidentiality, right? Next one, STDs. What are the most common STDs? Whoops. Oh. Okay. Here they are: gonorrhea, syphilis, chlamydia, herpes, HPV. And then it goes through, hepatitis, all 3 hepatitis, hepatitis. TB, we need to know about TB. How do you screen for TB? Okay, so I'm on slide 11. We need to know about TB. How do we screen for it? Skin testing, possible chest x-ray if need be. Okay, if you have a positive PPD. Okay. What's our role? Right, we're using all levels of prevention. Okay, and we also are wearing several different hats with regards to this topic. We become a counselor, an educator. I know as a nurse, I was for the high school kids, middle school kids, I was an educator, did all these preventative classes, but I was also a counselor if something happened, an advocate for my kids in the schools, case manager. You know, if I had a pregnant high schooler, she required a lot of resources, right? She needed doctor's appointments. She needed to stay in schools. She needed emotional support. You become a case manager. And then community outreach. Okay. There's a couple things in the book I want to go over. You probably already know what I want to go over, but I want to go over it. I want to make sure that you guys. Okay, so there's your objectives. Right off the bat is our Healthy People 2030. Okay, it's on page 218. This is related to communicable, these particular communicable diseases we just talked about. Reduce infections of HPV. Right? Reduce the rate of mother-to-child HIV transmission. Increase the proportion of adolescents who get the recommended doses of the HPV vaccine. Okay, then the chapter just goes right like the PowerPoints did. Talks about HIV. Then we have a little break here. Here's your QSIN box. Okay, the competency here, the targeted competency is evidence-based practice. And it tells you what that is, to integrate best current practice with clinical expertise. Okay, and here's your knowledge, skills, attitudes that you should be practicing to be competent in evidence-based practice. This is all over Next Gen. That's why I go over it with you. Okay, this QSIN is Next Gen focused. Targeted competencies. Okay. Oh, and here, remember I said I want you to know the modes of transmission of HIV. Box 12.1 is a nice summary of that. The slide kind of abbreviated this, but this is a nice explanation because that's the most important thing I want you to know is what is the mode, how is it transmitted? Transmit. How's it? Okay. What else did I highlight? There's your STD section. And really what I want you to know is what was on the slides. What's the most common STDs? What did we say? Gonorrhea, syphilis, what else? What?
HPV.
HPV, and there was one more, chlamydia. Okay. So you don't need to go through and read this whole section on gonorrhea. I just need you to know the 4 most common sexually transmitted diseases. That's why it's not highlighted. Okay.
Oh, good job, Dad. Oh.
Yes, there's 3 types of hepatitis. But maybe what you need to know, maybe what you should know is simply the mode of transmission for each of the 3. Okay. 226. There's a nice case study in here. If you'd like to try it out, it's about hepatitis. You know me, I always believe in case studies. Case studies, rationales, and practice questions. Right? Those are my 3 favorite learning modes. Case studies, anytime you can get your hand on a case study, anytime you can get your hand on rationales, like your NCLEX, and anytime you can get your hand on practice questions. Now that I said that, did you guys know hang on. Oh, I'm not going to mess things up here. In your student resources, we'll talk about that at the end. Okay.
Were you getting ready to say when you click on the book, it'll take you to like the evolve stuff?
Yeah.
We don't like I went through and I like did it. You have to go through like My Evolve to get in there. But if you do it through student resources, it says access denied, and it says that it sent you a notification about it. So I
Me?
actually tried to do it again in the beginning of class. Because it has
'Cause-
some, like, I know some books have like the NCLEX review questions. There's,
Yeah,
like,
yeah,
some
yeah.
questions. We don't have access to that through Canvas.
Because all my PN classes have access to it, and we actually pull all that stuff up during class and go through it.
Oh yeah, I know some people do it like when we're studying like for med surg and stuff, like you
Oh,
can go
yeah.
through and like click on them and do the questions. But
Mhm.
when you do it through for this class, if you click on the student resources, it says that we don't have access.
I think it's something that you have to switch on your end.
I'm sorry?
I think it's something that you have to switch on your end for us to do it, to have access to it.
It's not something that I have to do. It's something I need to put a ticket in for Evolve.
So I think I took the actual book, like when you click into the book for the reading and vital source, when you first do it, it'll give you an access code. And then you can go into like My Evolve where like you register for HESIs and stuff.
Uh-huh.
And you click on the book, enter the access code, and you can access it through there. But you
Oh,
can't get to it from Canvas. And most people are not going to take the kind of time to do that.
no, I know you're not gonna have time to do it. However, if you had access to it, those are the kinds of resources that I find most helpful for students. They have the they have the NCLEX practice questions. They have the case studies. Right? And they
Right. So if there was a way that like I don't know who you would talk to, like Professor Lundy or whoever like is in charge of giving us the access through Canvas. It's much easier to do it through Canvas instead of going through all that.
Oh, totally. Well, like I said, I'm the course lead for the PN program. They all have access to it right through student resources. They just click on student resources and everything pops up. So we've had this problem in the past in the RM program. So I thought this was corrected. So thanks for letting me know that. I appreciate that. So there's a case study if you'd like to do it. And then I'm always going to refer, here's our levels of prevention. Okay, so this is our nursing interventions related to communicable diseases. So I'm going to have you read that on your own. Okay, because I want to keep moving here. So if for some reason you don't understand page 231, this is our levels of prevention box, which we go over in every class or every chapter. Please let me know. This is actually a really good one. Okay, talks about education, screening, and management. So have a look at that, please. And then the last part is the summary. Okay, I'm always going to highlight this for you because this is an excellent, excellent summary of the chapter. Okay, that's on page 235. Okay. All right, let's move into our last chapter, 27. Okay. This is kind of a hard chapter to cover. Violence and human abuse. Okay. Your objectives talk about identifying types of child abuse, neglect. How do you teach the community how to recognize signs and symptoms? How do you work with victims of human trafficking? Okay. We know that violence is a huge public health issue. Okay, that threatens it's a social and developmental threat. It's the leading cause of death and disability that disproportionately affects youth, low-income populations, and people of color. So here's a good question. select all that apply of what are the leading causes of death and disability that, who are the populations disproportionately affected by violence? Select all that apply. Low income, youth, and people of color. Those are your three answers. I'm not giving you the question. I'm just saying if that was a question. Right? So as you're going through the PowerPoints, pick out things like that. When it gives you a kind of a pop, the leading cause of death and disability from violence affects three populations. Three parts of the population. Okay. What are some definitions? And this is covered right in your chapter. Okay. Really what I need you to know are what's the definition of interpersonal violence and self-directed violence? Okay. Interpersonal means between people in the community, intimate partner violence, sexual violence, self-directed violence, suicide. Okay. What are some social and community factors that influence violence for them? Okay. Individual, relationship, community, and societal. Okay. Okay. Individual. What's your biological history? Are you predisposed to anything? Right? What's the likelihood of you becoming a victim or a perpetrator? Or do you have a history or current use of substances, addictions? Okay. And you can, you guys, your picture's down there, but this slide has some notes on it. Make sure you take a look at those. It goes through each one of them. Okay. Some definitions of violence against individuals or oneself: homicide, assault, sexual violence, human trafficking, and suicide. We hear a lot about human trafficking nowadays. Okay. What does family violence and abuse look like? How are family violence patterns developed? What are some types of abuses? We all know that we're mandatory reporters, right? Every one of us. Is that just at work? Where are we mandated reporters? Anywhere we are, right? Grocery store, gym, bouncy world. We're all mandatory reporters. Okay, what's intimate partner abuse? You know, what if you're working in the ER, you're working in the urgent care, and woman or man comes in and with their partner and they're in a crisis situation, and how do you know how to talk to? I'm going to show you something in the chapter that I think is good. How do you know what questions to ask? How do you identify patterns? Okay, what are our interventions? Well, we have to be able to identify the victims, right? As a school nurse, saw everything, right? We did home visits. We saw kids in the clinic, kids in the classroom, kids on the bus that were victims of abuse. Okay, I want to jump to the book here because this has some good nursing interventions to go through. Okay, there's our objectives. Okay, Healthy People 2030 is on page 484. Okay, their objectives are reducing violence, since that's the chapter we're talking about. Okay, three pretty important objectives: reduce gun carrying among adolescents. That'd be great. Reduce intimate partner violence, reduce the number of adults who report 3 or more adverse childhood experiences. Talked about this. We just went through the slides: social and community factors influencing violence, individual, relationship, community, and societal. And it goes through right here and talks about the 4 of them. I just need you to know what the 4 are. Okay, here's the section on violence against individuals and self. Okay, again, the PowerPoint is fine. What's assault? You don't need to go through what types of violence against individuals or oneself. Homicide's 1, assault's 1, sexual violence and rape is 1, human trafficking is 1, and then violence against self, suicide. Okay. And then here's your section on family violence. How do abusive patterns develop? But what I want to take you to are a couple of boxes. Okay, I don't need you to memorize these boxes, but at some point in your nursing career, you will probably be faced with doing assessments, doing your ADPI with victims of abuse. Okay, and I'm not just talking child abuse, I'm talking partner abuse, interpersonal abuse, family abuse, whatever. You're gonna at some point be working with potentially these victims of abuse, human trafficking. So here's a couple of good boxes for you to just have a look at. Box 27.1. What are the risk factors for child abuse? I need to know these 11 inside and out to be working in the schools. Okay, anytime there was a suspected, or red flag, I would have to go through this list and I would have to know all the questions to these, because I wanted to make sure that if I had to make a report to social services, I had this information. Okay. Another good box, another good checklist to, again, you don't need to know this for the exam, but it's important to know this to understand the concept of violence and abuse. Excuse me. How do you potentially identify abusive parents? Okay, and I think there's one more there's a case study in here if you want to do it. These are the different kinds of abuse: child neglect, sexual abuse. It was on your slide in the PowerPoint. And then this is a big one. It wasn't covered in your PowerPoint, but the abuse of older adults. Review this section, page 497. Elder abuse is big: an intentional act or failure to act that causes risk or harm to an older adult. Elder abuse is huge. Okay, here's your QSIN box. Okay, we have another competency to look at: teamwork and collaboration. Okay, and it gives your KSAs for what you should be doing to practice to become competent with teamwork and collaboration. Excuse me. So again, review this. Okay, page 498. What I'm really trying to get to is, okay, Box 27.2. Just again, another checklist to read and be familiar with, assessing for violence in a community context. And here's things to look at. So some individual factors, some family factors, some community factors. You know, what if you, let's take one of each. What if you take somebody who has signs of physical abuse? I'm taking the top one in each of these three. You have somebody who has signs of physical abuse. They also have economic stressors in their life. And they live in a community that has a high crime rate. What do you think their potential to be in abusive situations, think that goes up? Of course it does. Okay. And then this is the last box that I really like. Nothing to memorize for an exam, but if you're trying to wrap your head around this concept of violence and abuse, this is good information to read. What are some prevention strategies for violence? Okay. And here under individual, it actually gives you to the right, is it a primary or secondary strategy? And what are some prevention strategies at the community level that we as nurses can be involved with? Policy, develop resources, shelters, transitional housing for victims of abuse and violence. And then here's your level of prevention box, page 500, and it's related to violence. So again, you should have a pretty good understanding at this point of primary, secondary, and tertiary. So you have 4 chapters to review, 4 boxes. Make sure you understand. If you don't, please let me know. We'll need to go through them. Okay. And then as always, remember this. Nice summary. And this last bullet here, COVID increased the incidence of family violence. I can't tell you I cannot tell you the amount of violence and neglect that happened during COVID when we started seeing kids coming back. I mean, let's say you live in a house where you're a kid and you're being neglected. Okay. And then you have to stay home for 18 months. Or you're a kid who is experiencing child abuse and you're home for 18 months. Bad news, right? Or parents that are perpetrators of domestic violence, right? But the kids go to school and all that happens when the kids are in school, right? But now the kids are home for 18 months. Look what they potentially might see. Very troubling.
And now it's worse because you've got decreased income, you've got more isolation. Yeah.
Totally. It's a recipe for disaster right now. When I talked to the nurses that I used to work with for 20 years, so still friendly with lots of them that have started the school year already. Started a couple of weeks ago. They started 3 weeks ago. The kids came back this past week and they said the level of mental health issues or kids that are anxiety, aggression, isolation, they're saying it's off the charts. So yeah. So anyway, hard chapter to cover, but unfortunately, it's reality right now, especially with your younger generations. The suicide rate of middle schoolers and high schoolers has skyrocketed after the pandemic, during the pandemic. So anyway, so I don't want to end on that note. So let's all pull up our Let's pull up our attestation. Okay, week 7 attestation. Did Megan ever come in? Let's see, Megan. Megan, are you here? Blake, Blake, you came in, right? Where's Blake? There you are. You came in. Okay. All right, what's the first question on our attestation? I don't have it pulled up. I'm just looking at all your faces.
The signs of family and hold on, I had it. When discussing family violence and abuse, what are the signs of abuse?
Go ahead. What are they?
So would that be like the isolation, the threat, intimidation,
Mhm. We can go right back
those
here.
things?
Yeah, we can go right back here. Where's our box on? Ah, nope. So, right here. What's the question?
Signs of family violence and abuse.
Well, here's a good start. So what do you guys think? Family, I don't know, what about, trying to get back to you guys. What about what are some signs of family abuse? I can tell you in the elementary school, kids talk. All right, so kids a lot of times are the conveyors of the information, conveyors of what's happening at home. So that would be one. I mean, there's a whole, who has some? There's a whole list to rattle off. What are some signs of family abuse? Tech has something in the chat. Or the same could be said for a couple who shows up at the ER. You know, that the parents are the ones who are in the violent relationship. Or the kid is the victim of child abuse. Or the grandmother living with them is the victim of elder abuse. Okay. Thanks, Tech. What is the, what's the second question?
Re-emerging infectious diseases, but it calls for 4.
Okay, I'll have to change that. There's 3.
COVID.
West Nile, COVID, and Ebola.
I put that one.
It's on your slide. It's on one of your slides. Ebola, West Nile, COVID. So thank you, Tiffany. We'll have to get that changed for the questions.
She put it in the chat. Tiffany did.
So emerging. Okay. Not 4. And okay. So COVID is in the new version of the book. That was not in the old version. So I'm glad that's in there. Okay. And you should only have 2 questions, right? Okay. So you guys have like possibly 20 minutes of the gift of time since you've just come from a PEDS exam.
Thank you.
Does anybody have any questions? I'd like some feedback. Was this class okay for you? Was there too much information? Did it flow okay for you? What do you think?
I liked it a lot better than the other classes we've had.
Who said that?
Erica.
What's wrong with the other classes I taught?
Well, no, but like it was more like it wasn't just
Tiffany!
going through the PowerPoint.
Tiffany, what's she
like,
talking
you
about?
pointed stuff out and like everybody like talked and
I think having the PowerPoints and kind of narrowing down there and not just necessarily reading from the book, I think is, at least for me, that was helpful. So
Good.
seeing it, you going back and forth, that was a good way to go.
Awesome. Awesome. That's great. And if you haven't had a chance yet, all the feedback you can give me, I would really appreciate. Okay. I want to make sure I'm meeting your needs or I'm doing my best to meet your needs, and I can shift. I
would
can
you let
make-
us know if you get that student resources button resolved so that we can access the book?
You bet.
Like
I
the extra resources that they have?
Yeah, I have three things or two things I need to do for you guys. I need to figure out why your peer reviews you have denied access, and your student resources, both on my list. If you haven't filled out the midterm evaluation for the class and for me, and if you want to give me some feedback, I always love feedback. I appreciate it. I already got a couple of evaluations. So yeah, the more feedback you can give me, the better I can be at meeting your needs. So. Okay, does anybody have any questions for everybody? And if not, we can be done, and then whoever has any questions can stay on after. Anybody have any questions for everybody? And don't forget, I posted an announcement yesterday or the day before with some times over the next couple of days to do exam review.
The
if you'd
next
like to.
exam is week 9, correct? That's
Mhm.
that Monday. Okay.
Yep.
What's the
Okay.
average grade on the community HESIs?
What is
Could
the
you
average
recall-
grade?
Yeah, like what's the average round number on community HESIs?
So my average grade that I want you guys to get is 1200.
That's yeah, and everyone says that, and everyone also says they wanted 900, and but just in the previous couple terms.
That's it. I'd have to look that up.
Oh, okay.
I have to look it up. I have to say though that most students do really well in their HESIs. They do.
That's what people from last term were saying, that the community HESI, most people did okay on it.
Mm-hmm. And that's because we gear our teaching each week towards the HESI, because if you look at the HESI study guide, in week 10, instead of class, we're going to do a HESI review. Okay. And so we have already looked at previous HESIs and we know the topics. We don't know the questions because we don't make up the HESIs. The HESIs are like the NCLEX. They pull from a bank of 1,500 questions, but we know the topics that are covered. And so that's what we review with you, is the topics. Okay, and these are all topics that are covered all through the term. So we try and make it as seamless as possible for you. Not a lot of extra work for you, that the teaching during the weeks is what you need to know for the HESI. And not a lot of extra fluff. Okay. Okay, now you're down to 17 minutes of the gift of time. So everybody go get some rest. It's really nice to see everybody tonight. Okay, and I hope you have a good rest of the week. Okay.
Thank you. You too.
Thank you. You too.
Bye. Have a good night.
Thank you, you too.
Thank
You're
you.
welcome, Ted. You're welcome.
Thank you, Prof.
You're welcome. You're welcome.